Um, so I revised from last week and I changed my order to descending order. And my audience for today is a group of high school students that are looking to go into nursing, really of any sort, whether it's registered nursing or an LVN or specialized field. And I'm going to lay down the facts, and these facts stand for all nurses, whether it's a specialized field, LVN, or a registered nurse, and it doesn't matter where you want to work because these rules will always apply. Daily duties that a nurse has to go through are the most important thing. They have to do hygiene, which means that they have to brush that person's teeth, give them a shower, help them change their clothes, brush their hair, shave their face, and change their bed. Because if you are, whether it be a hospital or a nursing home, you're always going to have people that are going to be laying in bed for hours upon hours upon hours every day. So you have to change their sheets. Now, another thing to remember is you're going to have patients that are still going to be able to do everything for themselves, and that is encouraged. You try to get the patient to do as much for themselves as you can because it helps raise their morale and feel like they're not so helpless. And another extremely important thing is to give medication. Some have to give medication at a specific time every day to keep their drug levels correct, and then some have to give medication at, like, say, 8 o'clock, and you have to give it within 30 minutes of that time. And that's not that hard. Another thing is every day you'll be filling out a nursing care daily plan. This includes your assessment, at least one NANDA nursing approved diagnosis, like your self-diagnosis of that person, nursing interventions, expected outcome, and then a follow-up to see if that outcome that you said is what it actually came out to be. Several other things that a nurse will have to do every day is you have to record all necessary data. So you have to record an injury, you have to record you have to take vital signs, you have to record whether they're getting better or not, just things like that, different symptoms, if a symptom has improved or worsened, things like that. Another very important thing is to communicate with your healthcare team. So that means your doctors, your other nurses, also the family members of that person, and you need to be following all legal standards whenever you are in a hospital. Because they're just like in the regular world, for a nurse, there is a set standard of rules that you have to follow in a hospital or a nursing home or wherever it may be that you're working. Another thing is check all equipment before use and check all equipment that the resident or the patient or whoever it is using at the time. That means like life support and all, like their IVs, everything, check all of it. And another thing is to maintain confidentiality of the patient's records. Now we'll talk about hours. You can work the morning shift, the 6 to 2, the noon shift, the 2 to 10, or the night shift, the 10 to 6. You can work 5 8-hour days, 4 10-hour days, or 3 12-hour days, depending on the type of nursing, because you always have to have a nurse on duty. And you get 40-hour work weeks, and your money can vary from $30 to $45 per hour depending on the state you're in, where you are at the time, and things of that sort. So if you're interested in nursing, do some research on your own, and you might just find out that that's the perfect field for you.